And here is your question. Okay, so if you have read and understood, considering it history taking station, kindly begin.
Hello, good morning. I'm Dr. Hong, one of the surgical doctors here. Today I'll be taking care of you. Before starting, can I confirm your name, please?
Okay, I'm Mr. Smith Peter. I'm 43-year-old.
Hi, Peter. Nice to meet you here today. So, how can I help you today?
Pardon?
How
Can
I
you
help
speak
you
little
today?
louder? Thank you.
Okay. Yes,
Sorry.
I'm here today. I've been having pains in my leg for the past 8 weeks now. So that's why I'm here today.
Oh, I'm really sorry about that, Peter. So, could you please tell me a little bit more about it? How it started, and what's the character?
Okay, well, the pain started gradually 8 weeks ago, but has been becoming more, usually very cramping, that we dull and cramping at times occasionally. That's how the pain involving both legs for that matter. So it's terrible and doesn't make it easy for me to walk.
That sounds really bad for you. I understand that you are having a difficult time with that. So, Peter, are you in pain at the moment? Do you need me to give you some painkillers?
No, I'm fine, doctor. I'm fine.
Okay, right. So does the pain stay there all the time, or does it come and go?
Yes, it's more when I'm walking. Then by the time I rest, I'll feel a little bit relief. But once I want to walk, by the time I walk short distance of maybe 50 to 100 meters, the pain becomes so severe that I have to sit and rest and before I'll be able to continue the journey.
Do you feel like the distance that you can the distance you start to have pain is getting smaller?
Yes, the distance is getting smaller. You are right.
I'm sorry about that. Mm, and then did you notice any changes,
I
skin
noticed that my
color
muscles
changes
are
on your
becoming
legs?
thinner, my legs are becoming thinner. I don't know what is responsible for that. And my ears too. I noticed there was some ear drop off.
Sorry, pardon?
I noticed that some ear on my legs also fell. Yes.
Ear. Oh, okay. Do you mean the color change?
No color change. I don't have color change in my. It's just that the muscles are becoming smaller. My legs became smaller.
All right. Is there any change in sensation of the
No.
lower
Like,
legs?
if anything touches my leg, I will know. It's just that at times when it's cold, it also make the pain to become worse.
I'm sorry to hear that. Yeah. Did you notice any? Your skin is becoming shiny without hair.
No,
All
that.
right. Is there any leg ulcers? All right. Have you? And
Yes,
is
this is
this
the
your
first
first
time.
time having pain like this? How would you rate the severity of the pain on a scale of 0 to 10, 10
I
being
will
the
raise
worst?
it as 7.
Mm,
7/10.
yeah. Have you undergone any surgery for your vessels before?
No, no, doctor.
Okay. Any history of amputation?
No, no,
Right. Do you feel like the pain in your leg is coming from your back as well?
no, no. I don't have pain in back. It's not.
Do you feel like your legs is very swollen?
No, no, doctor.
Have you been mobilizing these days? I mean, have you been sitting in, lying in bed almost all the time?
For because of the pain, I can only manage to get to the bus stop and then I'll get bus. But even with that, it's usually difficult. So most time I only stay within my house or just come out to do some things outside and go in. I can't walk long distance again.
Okay. Is there any particular medical problems you see in GP regularly?
Yes, I'm hypertensive, and then the GP. The last time I went to see him about 6 months ago, he said the lipids my lipids too are high, so he also gave me for drugs. I'm using drugs for both of them for the past maybe 10 years now
Uh,
for the hypertension.
are they under control?
Yes, the doctor said it's fine, that the BP is well controlled.
Great. Have you undergone any surgeries before?
No, no,
Any drug allergies?
no, I don't have any drug allergy.
Apart from the drugs you mentioned, is there any regular medications?
No, only those two. Apart from those two, none.
All right. Do you usually, is there family history of heart disease or like circulation problems?
No, no, doctor.
Okay. The next questions will be quite personal to you. Are you happy with me to proceed?
Yeah, no
Right. Can
problem.
you
What do you do
summarize your
for?
history now, please?
Okay, so I just took a history from a 43-year-old man who presented with who presented with, sorry, how many months? 8 week history of 8 week history of leg pain, which is gradual onset, cramping character, which is more exacerbated by walking, relief by rest. Now he can only walk 50 meters. The pain comes appears when he walks 50 meters, so which is affecting his daily activities, and the severity is 7 out of 10, which are consistent with lower limb perivascular claudication.
Any radiation?
Uh, Sorry, I forgot to ask that, but there
Okay.
is no pain coming from the back.
Can you
there's-
tell me what are your provisional and differential diagnosis then?
Provided with history of diabetes, hypertension and hypercholesterolemia. My provisional diagnosis is perivascular disease, maybe vascular stenosis, and then I will also consider neuropathic pain radiating from the back, sciatica, or DVT, deep vein thrombosis.
Okay.
So,
how do you plan to manage this patient?
the first thing is do the lower limb vascular examination as well as neurological examination of the lower limbs and cardiovascular examination, and then proceed to investigation with bloods, routine blood, full blood counts, USNC, liver function tests, and with HbA1c and fasting cholesterol level as well.
Okay. What are the
For the-
treatments?
and
Alternatives?
for the specific management, I need to do ABPI and tubeless ultrasound or CT angiography. For the treatment plan, it is endovascular stenting, bypass, or amputation in the worst case scenario.
Yes. If medical management fails, then what is the
Medical management is to stop if there is a history of smoking. Educate the patient to stop smoking, and then adopt to healthy diet and healthy exercises, and that's the conservative management. And then to give statins, setting as well as anti-hepatitis drugs. We're studying aspirin or anticoagulants.
Okay, good. Thank you.